Hi friends, welcome. Today we will talk about FIP and its form wet FIP. Feline Infectious Peritonitis, FIP, is a viral disease that affects cats. It is caused by a coronavirus, specifically the feline coronavirus FCOV. FCOV is commonly found in the intestinal tract of cats and usually causes mild or no symptoms at all. However, in some cases, the virus mutates and causes FIP. FIP occurs when the mutated form of the virus infects certain white blood cells, which then leads to an abnormal immune response and inflammation throughout the body. This chronic immune response causes damage to various organs, including the liver, kidneys, lungs, and abdomen. FIP can either manifest as the wet form or the dry form. Symptoms. In some cases, cats will have excessive thirst and urination, vomiting, weight loss, and jaundice. The wet or effusive form of FIP is characterized by the accumulation of fluid in body cavities, such as the abdomen or chest. This fluid buildup can cause distension, difficulty breathing, and weight loss. On the other hand, the dry or non-effusive form is characterized by the formation of immune-mediated lesions in different organs, which can cause a gradual decline in the cat's health over time. Diagnosis of FIP in cats. FIP is difficult to diagnose. Many of its symptoms could also be symptoms of other issues, and there is no single blood test available to confirm FIP. Your veterinarian is more likely to assume FIP is present if your cat has a low number of white blood cells, has an unusually high number of white blood cells, has elevated concentrations of protein in the blood, shows yellowing of the gums or eyes, is in a higher risk group, young cats or cats living in an overcrowded environment. If there is a buildup of fluid in your cat's abdomen or chest, your veterinarian may collect a sample of the fluid for testing. Fluid with a high protein percentage is an indicator of FIP and will frequently be yellow-tinged. If FIP is suspected, your veterinarian may take an X-ray or ultrasound of your cat. Revolta test positive with Kitty's fluid. We will discuss Revolta in another video. There are a few other tests that might help support an FIP diagnosis. The immunoperidoxase test can detect white blood cells infected with the virus. Polymerase chain reaction technology can be used to test for virus in the tissue or body fluid. Sometimes a biopsy of the infected tissue inside the abdominal cavity may be performed. FIP is a complex and challenging disease to diagnose definitively, as clinical signs and laboratory tests are not always conclusive. Veterinarians may rely on a combination of medical history, physical examination, blood tests, and sometimes even biopsies or fluid analysis to reach a tentative diagnosis. Unfortunately, FIP was generally considered fatal in the past. GS441542 is an antiviral drug that has shown promise in the treatment of feline infectious peritonitis, or FIP, a devastating and often fatal disease in cats. It is a close analog of the drug remdesivir, which has been studied extensively for its antiviral properties against various human coronaviruses, including SARS and COVID-2. The success of GS441542 in treating FIP comes from its ability to inhibit the replication of the coronavirus responsible for FIP. FIP occurs when the mutation of FCOV allows it to replicate in macrophages, the immune cells that should eliminate the virus. This leads to a destructive inflammatory response and the development of FIP. GS1441524 works by targeting the viral RNA-dependent RNA polymerase, which is essential for viral replication. This inhibition prevents the virus from reproducing, allowing the immune system to control the infection and potentially reverse the disease progression. While GS441524 has shown promise resulting in treating FIP-positive cats in some cases, It is important to note that it is not an FDA-approved drug for veterinary use. The availability of GS441542 is limited, and its access can be restricted to certain circumstances, such as participation in clinical trials or compassionate use programs. The success of GS441542 treatment can vary from case to case. Some cats have shown significant improvement in their clinical signs, while others may experience a more modest response. Factors such as the age and overall health of the cat, the stage and severity of FIP, and other individual factors can influence the outcome. It is crucial to work closely with a veterinarian experienced in FIP treatment protocols or in collaboration with a veterinary specialist who can guide and monitor the treatment process. Treatment with GS441542 typically involves an extended course of intravenous or subcutaneous administration, often lasting several weeks or months. While GS441542 has shown promise resulting in clinical cases, it is important to approach its use with caution, recognizing that more studies and further research are still needed to establish its safety and efficacy. Consulting with FIP groups is essential for understanding the potential benefits and risks associated with the use of GS441542 in the treatment of FIP. Prevention of FIP primarily involves minimizing exposure to the virus. Good hygiene practices, such as regular cleaning of litter boxes and minimizing cat overcrowding, may help reduce the risk. Additionally, reducing stress and maintaining a cat's strong immune system can also play a role in preventing the development of FIP. If you suspect that your cat may have FIP or have concerns about the disease, it is crucial to seek veterinary advice and guidance. Vets can provide a proper diagnosis, offer support care options, and provide the necessary guidance to support you and your beloved feline companion.